This video explains the main steps of administering Alteplase and dornase in a pigtail drain or a pleurex drain connected to continuous drainage. The detailed protocol of the procedure is available on the MUHC intranet in the Policies and Procedures section. Search in the alphabetical sections Drains. A nurse can administer Alteplase and dornase in the pleural space only if the training with an educator was completed. If no nurse with training is available, the doctor or nurse practitioner will have to do the administration. Before starting, check that there is a three-way connector with a needle-free connector installed on the drain. The doctor or nurse practitioner must install a three-way connector to the pigtail drain. A nurse can install the three-way connector to the pleurex drain. See pleurex, continuous pleural drain connection and disconnection procedure for the adult patient. At any time, the nurse can install the needle-free connector. Here are the contraindications to Alteplase and dornase administration: an allergy to Alteplase or dornase, pregnancy and/or breastfeeding, presence of a bronchopleural fistula, history of pneumonectomy on the infected side, or in the last 5 days, a stroke, a major hemorrhage, major trauma, or major surgical procedure. You will need the following: equipment to take vital signs, 4 alcohol swabs, prepared syringe of Alteplase, prepared syringe of dornase, 2 prepared syringes of 10 mL of sterile normal saline. Refer to the procedure for reconstitution of medications as needed. Before each administration, wash your hands, wear appropriate PPE if the patient is in isolation. Identify your patient by using the double identifiers. Explain the procedure to the patient, take their vital signs, assess your patient's pain, and clean your work surfaces. Clean the needle-free connector for 15 seconds with an alcohol swab and let it dry. Attach the syringe containing the Alteplase to the needle-free connector. Turn the valve of the three-way connector so the off is towards the drainage system. Allow the drug to go into the patient. Inject the Alteplase. Remove the empty syringe. Clean the needle-free connector for 15 seconds with an alcohol swab and let it dry. Attach the syringe of sterile saline solution to the needle-free connector. Rinse with 10 mL of sterile normal saline. Remove the empty syringe. Repeat the same steps for dornase. Close the catheter for 1 hour. Turn the valve so that the off is towards the patient. After 1 hour, return the valve so that the off is in the neutral position, and open the drainage system. Place the drainage system under wall suction as prescribed. The following monitoring is required after administration of Alteplase and dornase: the evaluation of the drain output using the FOCA acronym every hour for 8 hours, and vital signs every 4 hours. Please notify the attending physician or nurse practitioner immediately in the following cases, but be sure to carry out an assessment prior to calling: suspected allergic reaction to the medications, rapid onset or intensification of chest pain, hypotension with a systolic blood pressure less than 90, or the appearance of a new episode of tachycardia with a heart rate greater than 120, onset or worsening of dyspnea, new episode of oxygen desaturation with a saturation less than 90%, appearance of hemoptysis, difficulty injecting the medication or rinsing the catheter, bleeding at the site of the catheter or through the dressing, presence of a suspected subcutaneous hematoma, any change in color of the drained pleural fluid. If blood is already present in the pleural fluid, drainage of more than 200 milliliters per hour for 4 hours, or drainage of 500 milliliters or more immediately after declamping the drain. Document at each administration vital signs in OASIS or MedUrge, the volume of irrigation on the pleural drainage documentation form DM number 2569 or on the input and output sheet in MedUrge, tolerance to treatment or any side effects in the progress notes using the DARP recording method. In the computerized medication administration record or CMAR, sign the medication administered.